Constantina, you will open the meeting. You are a medical doctor from Greece. You went to China for 4 years to study acupuncture in Tianjin, Beijing universities, and you obtained a MSc in acupuncture from the Guangzhou Medical University. You are specialized in psychology, addiction, neuroscience, and psychological diseases in University of Athens. You are also our General Secretary. You were president from 2014 to 2018. So now you are going to speak about the importance of acupuncture application on prevention and health.
Please, Constantina, please tell the people that we have captions if they need to.
Okay. There are captions also at the menu of of the Zoom meeting, so you can just press the button and choose your language, favorite language, in order to have translation during the meeting. Okay, I will make a short introduction about the importance of the topic that we have chosen for the webinar today. The topic is preventive medicine, acupuncture, and health. And I will just say a few words about what we know today, and we realize how important it is to use this concept of preventive medicine in our everyday practical use in clinics. Can you see my share? Yeah. So all of us are doctors, and what we do actually is we treat patients in our clinics. But if we go back to the definitions of our profession and also the definition of health, we should realize that what we should do is try to keep our patients healthy and promote health and not treat diseases. Actually, medicine, as we know, is a science that promotes and maintains health and well-being, and not just treating diseases. Of course, from the history of medicine, we have seen that we have treated so many diseases all these years of the history of the modern medicine. But same time, we realized that standard medical care, what we do in our everyday clinical practice, is not actually a preventive medicine or trying to maintain health or trying to maintain well-being of people. That's why we have so many modern diseases in the world and many problems that we even do not realize, like gene problems that are coming not from genetics as we know today, but from our everyday life and the environmental factors and everything. According to the WHO, we have 7 million people worldwide that die every year because of the atmosphere pollution inside our homes and outside from the environment. And this is something that we do not face in the clinics. Something also very important is to see, according to the WHO numbers, that in previous year, before COVID, the reasons that people died mostly are non-communicable diseases, and diseases that we do know today that all of them are preventable. That means that if we apply another kind of medicine, we could have better results in the health of the people worldwide. And after COVID, still the numbers remain the same. If you can see here, COVID changed a little bit the line of the root of the diseases, the death causes of the people. But actually, there are the same chronic diseases, like the heart diseases, like the lung diseases, and cancer, different type of cancers, and diabetes. So what actually these numbers tell us that the is that the problem of the 21st century is the chronic diseases that are coming up out of our lifestyle choices and also environmental factors, but at the same time that the kind of medicine that we apply to the people. These diseases are preventable, as we said before, and these numbers are really very high. So if we change the way that we promote medicine or we apply medicine, and we mostly focus on prevention, then we're going to have better results in the treatments of diseases, but also the kind and the quality of health of the people around the world. So what is exactly preventive medicine? Is a medicine that focuses on health, on individuals and on communities and on the environment the same. What we do, we try to prevent the symptoms and prevent things and lifestyle choices that for sure will produce a kind of symptom and in the future a disease. And this is according to the sources of the European Society of Preventive Medicine. This idea is not new. Actually, it's very old. It is coming from Greek medicine, from Chinese medicine, from all kinds of traditional medicine. And because I'm Greek, I can tell you that even Hippocrates, the 4th century before Christ, he said that illness is not coming out of the blue, but develops slowly every day, and we have some signs that we have to see before we have the disease, before illness appears. So the idea of preventive medicine is not new, but the modern medicine seems that forgets how to use preventive medicine. Okay, we know from the books that we have the primary prevention when we treat healthy patients, but actually what we do, only injections for children at this stage in the real practice. Secondary prevention is when we try to emphasize on symptoms before disease occurs. This is the pro-clinical stage. And this is something really, this is a very important period where we have to apply preventive medicine. Then we have the third stage, which is the tertiary prevention, and we already have a disease, and then we have to think how to prevent the worst things to come. So this is what we're gonna about what we're gonna talk today, how we apply modalities like acupuncture in order to make more easier the life of a patient. And finally, we have the quaternary prevention, which is really very new idea, and it's according to the Family Doctors International Dictionary, and it is the step where doctors have to protect patients from medical interventions, ethical medical interventions, and evidence-based medical interventions that mostly produce something harm than good to a patient. This is the main meaning of our webinar today, how to make a better medicine. So recent years, we know from guidelines published worldwide about acupuncture that we have recommendations, too many recommendations, 2,189 positive recommendations for 204 different health problems worldwide. So we can be sure as medical doctors that we can use acupuncture in order to apply preventive medicine. And what we know that we can do, we can strengthen the immune system, reduce inflammation, microinflammation, also very important for modern medicine, reduce stress, balance the central nervous system, regulates hormones, pain management, and regulates the pain system, mental health maintenance in many different areas, improve sleep quality, improve digestive health, and even many more. As the Chinese used to say, acupuncture improves balance, and homeostasis, something that in modern medicine we know very well that it is really very important. Something at the end of my speech, really also very important, is about one paper that published just a few years ago in 2022 and talks about evidence on acupuncture. And the conclusion of this very nice work is that we have so much evidence on acupuncture therapies, but the problem is that is underused in clinical practice and health policies. So what is important to inform people and to inform doctors and policy makers is that if we want to have a better medicine, if we want to have a better preventive medicine, then we should start using acupuncture in health systems worldwide, everywhere in the world, in all different areas of health systems. So that was, I think, the importance, what we thought as a group in ICMART, and we put this title for the webinar of this day. Thank you very much, and I hope you will enjoy the talks of all the important speakers who are coming next. Thank you.